Welcome, everybody. We will go ahead and get started, and hopefully others will filter in and join us. Welcome to the Sharing Your Head and Neck Cancer Diagnosis and Managing Ongoing Communications webinar. It is presented by the Head and Neck Cancer Alliance and American Head and Neck Society. My name is Dr. Brooke Worster, and I'm an associate professor of medicine at Thomas Jefferson University and the Division Director of Supportive Oncology at Sidney Kimmel Cancer Center. And all of that is a mouthful to say that I have background training in cancer management, cancer pain management, and palliative medicine. And I get the privilege on a regular basis of getting to sort of hear and share and follow along with patients on their cancer journey. And one of the biggest things that we talk about a lot is the communication piece, and how do I share this, and how does it change over time, and what does it impact my loved ones and my caregivers. And I'm so thankful to our Head and Neck Cancer Alliance Ambassador panelists for joining us today to talk about how they've shared their head and neck cancer diagnosis with loved ones, as well as managing ongoing communication with family, friends, employers, coworkers. I think the list could go on and on and on. And one of my favorite quotes from George Bernard Shaw is, "The single biggest problem in communication is the illusion that it's taken place." And I think there's maybe no better place than kind of surrounding a cancer diagnosis and the ongoing communication surrounding that, where that quote becomes applicable. So welcome, everybody. And without further ado, I'm going to have each ambassador panelist introduce themselves and tell you a little bit about kind of their journey in the diagnosis and communication. We'll start off with Gail Jackson. Oh, Gail, you're muted.
Hello, everybody. Thank you very much. My name is Gail Jackson, and I currently live in Rehoboth Beach, Delaware. My cancer journey started in 2018. What started out as a sore throat was later diagnosed as being a squamous cell, HPV related, positive cancer of my left tonsil. And for sure, when I got that diagnosis, first of all, the first thing everyone thinks is, what is that? I've never heard of tonsil cancer. So as I got that diagnosis, sitting in the office with the doctor by myself, I had to decide, how do I present this? How do I handle this going forward? The first person that I needed to talk to was my spouse. And, I'm a retired clinician. So all the tools that I had used with clients on how to communicate with family members, how to process and get through different situations or challenges, now I had to use myself. So I tried to approach the diagnosis and communication as calmly as possible. And what I've learned over the time, this was in 2018, so I'm going into my 5th year. What I've learned over the time is how I present is how people sometimes receive it. So my spouse was automatically fearful and worried and thinking that that was the end of my life and the end of our life together, after being together for 30-something years. So I had to approach it very calmly and, let her know that, we were going to work through it. And the biggest thing besides my presentation is being as calm as possible, even though I had, fears as anybody would have. I think having her be a part of my treatment process made it easier for her to digest all that was going to happen for us and all that did happen to us. So she was a part of all the process, went to my different meetings, doctor's visits. I think the other part that made it more bearable and easy to communicate was that our team was so well at communicating. And the team that I had, was very open to sitting down and talking to us and kind of, allaying some of the fears that she had in particular. My sister, I would say, is a little bit of a dramatic person. So telling her the first thing she had, her thought was that I was going to be in my grave. Well, here I am almost 5 years later, and we're still surviving and still managing. So I think that what I would say for me is the calmness I try to present but also having a good team that could be a part of the communication, and also not being fatalistic, and knowing that when you have a cancer diagnosis, and also communicating that to our family members and loved ones, that it doesn't mean that we're going to be gone tomorrow. It means that we just have to figure out how to manage through the process and form a team and to do as best we can within that team. So that's a part of the process. I would just say my attitude and how I presented it reflected how they received it. And I don't know if anyone else feels the same way, but that's what worked for me. So that is my piece, and I will pass it on to the next person.
Thank you, Gail. That was wonderful. Next up, we have Laura Kadetsky.
Thanks, Brooke. Hi, everyone. I'm Laura Kadetsky. Great to have you all here today and appreciate you making the time to hear from us. I have had multiple squamous cell carcinomas and precancerous lesions removed from my tongue and floor of mouth over the last 12 years. So I have the unfortunate experience of having to share my cancer diagnosis multiple times, which means I've done this at different life stages and also learned from the experience each time. When I was first diagnosed, I wasn't married. I had just gotten engaged. So I had sort of a different family structure than I have now, when I have a husband and a child as well. And I'd like to share a little bit about talking to your children about a head and neck cancer diagnosis. The last two instances that I have had, my son has been 5 and 7. So he's been aware of what's going on. And it was much more important for me to purposefully communicate with him than it was when he was a baby or, not around before that. So a couple of things that I would share. The first is we took advantage of advice from people who were experts. So going to speak with the guidance counselor or the social worker at my son's school, we found to be incredibly valuable because they have unfortunately had the experience of working with parents at the school who have had cancer or other experiences, and they were able to provide books and resources and ways of framing the situation with research behind it that we found incredibly valuable. We also brought his teachers into the conversation both times over the last couple of years because they knew him even more than the guidance counselor knew him. So they could help us take the advice from the guidance counselor and really adapt it to the particular nature of our child. So I encourage you to get advice from the resources that you might have in your network. I'll then say every kid is different. So here's what worked for our kid. It might not be the same thing that worked for your kid. But for us, it was really important to find a quiet, not stressful time to share this information. So as Gail was saying, that calmness translates to the information that you're providing as well. So, for us, over dinner where we might talk about things, or another time where everything seemed to be stable and your child isn't hungry or tired and likely to kind of act negatively to whatever you might tell him or her. We also tried to use really simple terms adjusting for age appropriateness. It was, it's one thing to say there are bad cells in my body, which was a term that the guidance counselor encouraged us to use because cancer might not mean anything, but our child knew what a cell was, and we could explain that a cell was bad and needed to come out. Depending on the age of your child, naming cancer can be really important, but could also come with more negative connotations based on what your child has heard from movies or books or other people in their life. And so differentiating between what does cancer mean for me, what is my situation, it's not going to look like this movie you saw, can be really important to clarifying and helping to allay some fears. it was incredibly important as well for us to have an answer to what is going to happen to me, right? If mom's going to be in the hospital, who's going to be staying with me? Who's going to take me to my daily activities? Who's going to make dinner? This was especially important because 2 times ago, when I'd had a tumor removed from my mouth, it was April 2020. It was 3 weeks into the pandemic. And so this question of who's going to be home with me all day long was like front and center to our minds as well as my child's mind. And it turned out he was so excited by this, having someone come and stay with him and play with him, that excitement sort of overrode a lot of the fears that he had. But it was, he really wanted to know what is going to happen to me, and being prepared with that was critically important. And then, we prepared to share this information multiple times. Kids take in bits and pieces of things. They don't always take in the whole thing that you're trying to share. And they'll think of questions after the fact, especially as the circumstance gets closer and closer and starts to feel more real. So being prepared to come back and talk to your child again and again, and going through that, which can be hard for you, but it is really important to being there and helping your child through the situation. I look forward to hearing from everyone else. Thank you.
Thanks so much, Laura. And I think you raised a great point. I don't always think it's even just children that take things in bits and pieces, right? We all do. So, I encourage my patients to kind of not ever hesitate if they think of something after the fact. They're going to take in bits and pieces what their oncologist or what their surgeon or what their radiation oncologist told them, and write that down, or have an extra set of ears and go back and ask. I think that's a really great point. Next up is Christy Mason.
Thank you, Brooke. Actually, it's a very good segue. I'll talk a little bit about, being eyes and ears for your patient or for your person. So my name's Christy Mason, and I am a Caregiver Ambassador. I think I'm an OG Caregiver Ambassador here at the Head and Neck Cancer Alliance. And I joined really because I wanted to advocate for the caregivers, as they're a very important part of the wellness team. You have your doctors, you have your surgeons, you have the counselors, but also the caregivers are a very, very important part. And I'll tell you why. But part of it is a big part of it is communication. As an ambassador, you have to really, or as a caregiver, you have to have really good listening skills. That's part of good communication. Listen with intent. So a big part of what I did was I would go to these doctor's appointments and just soak everything in, take notes. I had a lot of notes. As a matter of fact, I had a spiral notebook. That's how I had to manage my thoughts, because when we would go to the meetings with the doctors long before my husband started his treatment, it was really, was a lot of information to take in, and I could see my husband sort of shut down halfway through the information process. So I really had to pick up and listen. You also become an interpreter as well. So my husband was diagnosed with tonsil cancer, stage 3, HPV related. He went through 30 rounds of radiation, which caused 3rd-degree burns on both sides of his neck. And he also went through either 6 or 7 rounds of chemotherapy. Now, because, he had this type of cancer, it was I guess the positive thing was it was a very long or very painful treatment, but it also had a high cure rate. But part of the pain was that my husband couldn't talk. So I had to become the interpreter and really be eyes and ears, look at what was happening to him, start taking those notes of what was he trying to say, how was he feeling, what was he trying to say that he couldn't say? So these were, I would say, think about your toolbox, and it's not just communicating, it's also listening, it's also interpreting, and it's also, to a certain degree, there were times where something maybe just wasn't right. And, I felt compelled to tell his doctors, here's something that I noticed, here's something that I witnessed. And so I think all of that is very important for a caregiver, is to really look at the other skills that are needed within communication. Lastly, I will talk a little bit about the communication between my husband and I, because early on, our communication became in stages, right? So in the beginning, we didn't know much about this cancer. Actually, we knew nothing about it. So we went through a big education process. You hit Google, which is probably the worst place to go, but you start doing some research there. You listen to the doctors, you listen to other people that have gone through cancer, but it's everybody's journey is different. And so in the beginning, we really became like show and tell. It was a lot of, here's what I learned. Here's what I learned today. Hey, did you know? So there was a lot of information sharing in the very beginning of our journey. Towards the middle of the journey, where he was well into treatment, like I said, I was the communication vehicle. He just physically couldn't talk. It was painful. And so, I became the communication vessel between him and the family, between him and doctors. The other thing that we also did too was my husband and I, we really, we tried to have a sense of humor about it. It worked for us. It might not work for everyone. But for us, cancer was every minute of every day for so many days of our lives, and we just needed a break. And so humor was a way that we dealt with it, and it was a communication vessel for us. So anyways, that is just some of the things I'm happy to talk about. I'm also happy to talk a little bit about telling work. That was a hard part for me. So a lot of us have jobs, and how do you navigate through that? And so I'm happy to talk through that too. But anyways, I just want to say welcome to everybody that's here. And I look forward to hearing from all the ambassadors on this panel.
Thank you so much. That was fantastic. And I loved how you said, listen with intent. I think that sort of perfectly captures a lot of what the job is. And it sounds like, and this is one of the other skills that you certainly mentioned that I know we talk about all the time, is how to advocate, right? So to advocate for your loved ones or advocate for yourself. I think we all wish the healthcare system was easier to navigate and communicate within, but it's not. And so I think, really strengthening that advocate muscle is important. Next up, we have Michael Murphy.
Hi, my name is Mike Murphy. It's a pleasure to be here today talking with you all. I was diagnosed with stage 2 HPV-related tonsil cancer back in June of 2020. And when I think about communication, I wish that I could say something useful or helpful about that kind of first communication, the communication to your partner. But really, for me, I was just so overwhelmed with the news. I remember sitting in the emergency department after, hearing that I might have cancer, that when I went home, my wife could immediately see that something was wrong. And she asked me what it was. And I must have said something because I did communicate to her, but I can't even remember what it was. And I think that's sort of where you start when you have cancer. You don't really know what to say. You don't really know what to do, but you sort of instinctively seek out the people who are around you, who are your supports. And I think that's really, really important, because yes, there are some difficulties in communication. You're often going to be holding people's anxiety, like Gail's sister, or like my mother and my own siblings, where people are concerned about you and concerned about what cancer means for them. But you're also going to find sources of help, and often people you wouldn't expect to be helpful or empathetic or understanding are going to come through for you in ways that are really, really great and really, really supportive. Like Laura, I have children. My daughter was 9 and my son was 5 when I was diagnosed. And that was also something that my wife and I talked about quite a bit. How do we talk to our children about this? What does this mean? I agree with Laura. Kids don't really have an idea of what cancer is at that age. And so the way we talked about it was we told them about the sort of physical changes that I was going to experience. And so they knew that I was going to have a feeding tube placed. They knew I was going to, get weak. I was going to lose my hair. I used to have a big full beard. They knew I was going to lose that. And so they weren't terribly surprised by it. And they also knew that the idea of the treatment was to get me better, and that hopefully I was going to get through it. And so when they saw these changes happened to me, they didn't think they were irreversible. They didn't think they were part of a decline. We encouraged my daughter, who was a little bit older, to write things down. And so she kept this long, detailed journal, which she's let me read once in a while. And it's notable because there is a lot in there about cancer. There's also a lot of stuff that isn't about cancer and seems like kind of mild or kind of distant from the cancer. And so even though you might be concerned that your kids are worried about your cancer, and they are, they're also having all these other kind of normal childhood experiences. And those don't stop just because a parent is sick. I will say my experience was a little bit distinct in that I was sick and receiving treatment kind of in the early height of COVID. And what that meant was that I had in some ways more communication I was responsible for. I couldn't bring my wife into the doctor's appointment with me. I had to kind of take my own notes. And my children were home. So I kind of was around them all the time. They saw the cancer and the treatments affect me. I couldn't be as selective as I may have wanted to be about what I was sharing with them. They kind of saw it all. I think definitely, communicating with work about cancer was challenging and something I thought about a lot. And then as sort of you progress through cancer, when you get through treatment, cancer is never really done. It's always going to be part of your life. And it comes up in weird ways. So for me, for example, I'm a psychiatrist, and the treatment for the cancer really damaged my hearing. And so sometimes I can't pick out words very well. And so when I'm talking to a patient, they might be surprised that I can't hear very well. And, I have to decide, okay, well, do I say, well, I can't hear very well because I had this medical issue and go down this whole road? Or do I just sort of, let it go? And this is a decision that I have to make, multiple times a month. And I think that the idea of how you communicate with people about cancer is kind of always changing. I'm happy to speak to any of those topics or any other questions anybody may have.
Thank you so much, Michael. And I think an important thing that you mentioned for everybody is kind of that it's always changing, right? That this is so fluid. It's not a once and done thing, right? Just the way cancer lives with you for the rest of your life, kind of the communication and the decisions around it do to as well. Next up, we have Chris Nolan.
Hi there, Chris Nolan coming from Fort Worth, Texas. I was diagnosed in 2011, stage 4 base of tongue, HPV related. My wife and I have 3 boys, and at the time, my oldest son lived fairly nearby, and my twins were at a college 2.5 hours away. They were in a master's in 5 program, so there was some pretty strict attendance. And so my wife and I talked about maybe delaying letting them know. The master's in 5 program was hard enough that they didn't come home quite as much as they probably would have otherwise. And so we even thought that it would be a positive if when they came back, I'd already been through some treatment and they could see that I was doing well. We obviously let close family know. And within an hour after telling close family, there was a very sweet and generic request for prayers from a member of my family. And when my wife and I read it, it applied to maybe 4 people, 2 of which were their parents. So we basically had about 5 minutes to get a hold of them before they discovered it on the internet. It was an interesting conversation we didn't get to prepare for, and maybe the lack of preparation may have even actually helped a little bit. But our biggest takeaway from that is that everyone you're dealing with is human at this, when you're telling this news, and it's probably not going to go the way you thought. And don't be shocked by it. Just be ready. Actually expect it to not go the way you planned. They did really well. And it's been, it says 2011, so I'm almost 12 years out, and very happy to be here. Thank you so much.
Awesome. Chris, that was great. I think you sort of hit the nail on the head that there's no right answer, right?
No.
This is not going to go whatever way you script it to go. And so kind of having the grace, both for yourself and for the people you're communicating with, that, there's not a right or wrong answer. As long as it feels okay to you, then you're doing it right. Our last panelist is Susan Smith.
Hi, I'm Susan Smith. I live up in Connecticut. I'm at work right now in Manhattan. I was diagnosed 2 years ago with stage 4 tongue cancer that spread to my lymph nodes. Like many people on our panel, it was in the middle of COVID. And so I spent that better part of the first year of COVID kind of trudging to doctor appointments by myself, going to the hospital for a 14-hour surgery by myself, and almost going all the way through radiation and chemo by myself. And so I think it's interesting joining a communication panel when so much of my personal communication around having cancer and my treatment was done through WhatsApp chats and text chats and FaceTimes. I don't have kids, and I think you know, if you don't have family that live close by, which I don't, you know, it was just me and my husband, communication becomes something you really almost have to focus on, because I think family, right? We all here react in so many different ways. My family immediately, half of them were like, you'll be fine. You'll be fine. I'm like, yeah, but it is stage 4. You know, not caught so early. And the other half were sending me Google clinical trials and research, which was, you know, super kind of overwhelming. It was a wide spectrum of kind of how people were responding to me. I think my biggest word around communication is boundaries. I think it's really important to sit down and sort of think, whether it's with your spouse, your partner, your immediate family, think about what kind of boundaries you want to set with what feels healthy for you. And how you want to interact with people around you, because you don't have to share all the details. And if you want to, you can share all the details. It really comes down to what you are comfortable with. You know, I'm sitting in the office now, and I will say work for me personally was a big piece of, you know, that I had to focus on and figure out how I was going to work through. I work in sales and marketing. I talk all day. I present, I sell. And my ability to talk, well, I think I sound pretty good now. 2 years ago was really a slurry mess. And it was really hard for me to even talk for 5 minutes straight. And so I think it's important, again, to go back to those boundaries and figure out, what do you feel comfortable with, whether it's with your family and friends or it's at work, and then how much information do you want to share. And you know, I think some of our panelists have said, you know, the reactions sometimes are what you expect or not what you expect. I think planning for those potential reactions is also really important, only for your own well-being, to figure out, well, how would I react to a statement like that? Or how would I react to a question like that? For me, it helped to sort of think about that ahead of time, so I felt more prepared and not on the spot or not feeling awkward or uncomfortable. My first week back at work, after I went through treatment, I lost 55 pounds, which is visually, you know, shocking. And especially when no one sees you that whole time, you just sort of show up 55 pounds later. You know, I had everybody in the office, from one person saying, you really have to eat more. Kind of hard when you lose half your tongue. 2, like, wow, you look great. Are you been dieting? And so I think being prepared for those kinds of statements or questions, at least for me, really helped, so that I could think about what I felt comfortable answering and how I wanted to answer those. So definitely boundaries is my key word, and happy to talk more about that.
Thank you, Susan. That's great. And I think we have a couple questions I'd like to toss out to all of you guys, but I do want to come back to get yours and everybody else's tips about, or thoughts about, communicating with your employer or colleagues, because that's like a very different kind of boundary than family. But first thing I wanted to ask, there were a couple thoughtful questions in the chat about kind of how, or did you disclose the HPV status or relatedness of your cancer to people, and how did that feel, and kind of what other questions came along with that? So I'll toss that out to all of you guys. Yeah, go ahead, Gail, you have your hand up.
Yeah, for me, that, I have to say, that was probably personally the hardest part, because it's like this unknown, and you don't know where, when, or how you got it. And so when you tell folks, because I initially would just say tonsil cancer, and I never put the HPV part on it. That came sometime later as I became more comfortable with the reality that it was what it was. But initially, I never said that because it was like a piece of embarrassment, or people thinking that, I had been running the streets of Rehoboth Beach and Philadelphia doing God knows what. I don't know. But I definitely was very secretive about that initially. And then as time has gone on, I've been open to disclosing it and talking about it and what it is and how it affects so many people. I don't know if I answered the question, but I guess what I'm saying is that it was a challenge. It was a real challenge for me, more so than just saying tonsil cancer. But having that other piece to it just made it more to me, it was stigmatizing because people kind of put you in a box or had a thought about it. So that was a challenge that I have gotten over. And now I openly talk about it and also talk about preventative measures going forward for young people in the vaccine.
That's great. Anybody else care to share their thoughts and experiences about that?
Yeah, I can, because I actually, one of the things that I advocate a lot for, and why I joined Head and Neck Cancer Alliance was just precisely that, is the vaccine. And so we actually lean into it and we openly talk about it because we use it as an opportunity to talk about get vaccinated, it works, and vaccinate your kids. After doing some work with the Head and Neck Cancer Alliance, I didn't even realize that you could get vaccinated up until I believe it's the age of 45. So, and I also, the other thing I would say too, is there has to be more awareness around this cancer. I was very shocked at the lack of awareness, but I remember my husband's doctor saying this cancer is at epidemic levels.
Chris, did you have something you want to add?
Yeah, so I was diagnosed in 2011, and it was a different world as far as HPV is concerned. I had never even heard of it when they told me. And they did tell me that my chemo brain on the word. My outcome would probably be, I had a better chance of having a good outcome from treatment. But as far as what HPV was, I had never heard of it. I have talked more openly about it, and I've heard more about it in the last 2 years and probably all the other years prior to that combined, I'm thinking.
Well, you guys are doing good work. You're getting the word out there. One question that just came up and kind of initially directed to Susan, but please, anybody answer this. When you disclosed, have you ever kind of hit the line and said, I've hit my boundary, and how did you communicate that, or what was that like? And so please, Susan, and anybody that has some thoughts there.
Yeah, I think for me, and again, everyone's different, but for me, my line sort of exists going into all of my surgery and reconstruction. I had to have reconstruction using a flap from my arm, a skin graft from my leg. And so, yeah, I know Gail and I both have the same scar. And I think unless it's with someone that I really am very close to, I don't personally feel I need to go through all of that level of detail. Because my experience, again, people just sort of react really strangely to it. I think that there's a higher familiarity with other cancers, like breast cancer, colon cancer. I think there's more awareness and a heightened level of understanding of maybe what those surgeries and treatments might look like. But for many head and neck cancer patients that I've talked to, there's just not as much understanding. I think I started at work and I started to tell someone about my arm and leg, and I kind of saw a look of terror, to be honest. And I sort of realized very quickly, like it was a little bit too much information. And then I felt uncomfortable, or that I needed to be feeling ashamed. And I did not like that feeling for myself. And so for me, again, it it was sort of, I'm fine sharing my diagnosis, maybe roughly what my treatment was, but I don't get into the individual details maybe of what has happened in the workplace. Again, everyone might feel differently. I think it's just understanding what you're really comfortable, disclosing, and then kind of going from there.
I'm happy to add to that a little bit. I also maintained very strict boundaries at work when I was first diagnosed. And I was lucky because I had surgeries that were at the first few times not as invasive, didn't have long lasting effects. I was not going through radiation. I was not going through chemo. And so at work, I said, I'm having oral surgery and I'll be back in a week. And I was very circumspect about it and really felt like it was not anyone else's business. And I didn't feel like getting into it with anyone at work. That became a lot more difficult as the surgeries became more complex, required significant time away from work. I had a reconstruction from my cheek, removed a number of teeth the last time. It's a lot more evident and certainly was closer to my last surgery. But I also made the decision to become much more public about my diagnosis when I had in 2020. Mostly because I felt like it was just astounding to be in the middle of a 100-year pandemic and have to go get cancer surgery. And so I became much more open about it and really flipped the switch from not telling anybody to being public about it and, working with the Head and Neck Cancer Alliance. And what really struck me is that I was really nervous to tell people at work and to be public. I don't know why I expected negative reactions and critique. Like I didn't know what to expect. And of course, everyone was lovely. People were nice. People don't attack you for having cancer. They can be scared, certainly, as Susan was saying. But my experience was that people overwhelmingly were supportive and kind. And I felt very gratified in my decision. It's interesting that I still feel like there are places where I have boundaries around certain issues, even though I'm much more public about the diagnosis and, when I have a recurrence and what will happen. But that was sort of my evolution over the 13 years I've been doing this.
This is great, guys. And there's so many good questions coming in. I promise we'll try to get to them all. I'm just sort of picking and choosing. Here's a really good one. Would you guys be willing to share your mental health journey post-diagnosis and treatment? Someone on the call is saying, and I'm sure as are lots of us, and thank you for having kind of the strength to say this, dealing with depression, frustration, guilt. I will tell you from the clinician side and where I sit, and Michael, I don't know, I'm sure you see this all the time too. One of the least discussed things is kind of how are you doing emotionally with this? And some of that I think is clinicians' own fear or lack of resources about, how to help you with it. But I think it's such an important part of this journey. So I'd love for you guys all to speak on kind of what that's looked like and how you've dealt with it.
I could speak a little bit to that. I think that, like probably almost everybody, I had shock. I was certainly really sad, really anxious. I was probably, depressed at times. And there are lots of different things that are out there to be helpful. For me, there were three things in particular. The first thing I did was I met with a therapist. Therapy, I tend to recommend therapy for everybody. It's really nice to be able to check in with somebody who's not your partner, but who is there to kind of help you work through things. And I had got my treatment at the Dana-Farber in Boston, and they have cancer therapists there who deal with this as their bread and butter. So they were super helpful. I didn't meet with them for years and years, but even just a few meetings, I think I met with them 4 or 5 times and kind of talked through some of my fears, some of my concerns, and they gave me some strategies and tips and advice about thinking through things. And then I'm also a big believer in sort of engaging with peers. So talking to people who have been through cancer, who've been through similar kinds of cancer was really helpful for me. And that's actually how I got hooked up with the Head and Neck Cancer Alliance, was that because I was communicating about my diagnosis, I met somebody who knew somebody who had a similar cancer. I talked with him, and talking to somebody who'd been through, the kinds of treatment I had and had made it to the other side was just so reassuring, so helpful. And then I also attended some groups for sort of young adults with cancer. And that was, to be honest, a little bit less useful because of when I got cancer, I felt like I was kind of between like the really young people who had cancer and the people who were much older than with cancer. There weren't a lot of people who were kind of in my age with young kids. And I do think that it's really important to find people who have shared experiences to kind of reflect with. And then in my own clinical practice, when I see people, certainly, there's lots of medications for depression. A lot of them work, and cancer doesn't affect how they work. So I encourage people to try all options that are out there.
Yeah. And it sounds like one of the most important things I'm hearing from you is what feels right for you, right? I will tell every one of my patients all the time, the fact that you're feeling this means you're human. I'm more worried about people that sail through this and say like, yes, this is just as good as a, Caribbean vacation. So I think it's just human, but I don't know if anybody else has other thoughts on that. One of the other things that's very much aligned with that is any advice on how to deal with kind of difficult questions that you've gotten? Someone said, what's the most kind of difficult question that you've been asked with non-family, and how do you deal with that if it's something that felt like really hard to answer? And I'll give you one tip from my perspective, and this is kind of me being a palliative medicine doctor. When anything feels really hard, be curious to the person asking, right? Instead of feeling like you have to immediately answer and jump in with something that is kind of, all thought out and perfectly eloquent. A lot of times when I'm stumped, I say, tell me what you mean by that, or tell me what you're worried about. I think that works really well with kids. If a kid asks you a hard question, because I think sometimes we think they're asking like the really hard, like, oh my God, is mommy gonna die? And really they're asking like, can I go to my soccer game this weekend, or is something gonna affect that? And so one tip I have, certainly not as impactful as those of our panelists, but is if it feels really tough, be curious, get a little bit more from the person asking it before you feel like you are required to answer it.
I think too, when you have cancer, you're under a lot of stress, and no one is at their best when they're under a lot of stress. And to me, the hardest questions were not from strangers. They weren't even really from work, but they were existing kind of difficult issues within my family, existing conflicts that were there, were all kind of exacerbated at various times. And so it's not as though that stuff kind of just goes away. You still have to deal with, if your sister doesn't like your wife or vice versa, or whatever it is, that stuff's still there, and you got to navigate that and cancer. And so communication is just so important.
Yeah, I would second that. I think I certainly got questions about my survival, what the percentages were, what the chances were, and I just answered them saying I don't know, because I think, Brooke, to your point, it's like you don't have to have all of the answers, and so it just became like I don't know, and that kind of stops the questions sometimes if you're not there immediately with a lot of answers, because I do think, to Michael's point, we all have sort of everyday struggles in our life that are not cancer related, but when cancer comes in, it sort of adds to your pile a bit, and maybe makes what is normally easier to navigate a little bit harder. I think that goes back to that question around, overall well-being and sort of, anxiety. And I agree with Michael. I personally have really taken advantage of talk therapy through the hospital where I was treated. I also agree it's really important to go to peer groups who have potentially gone through the same diagnosis as closely as you can get as you, because they will understand the most. They won't ask those really difficult, hard questions because they already know them and they know the answers. And I think leaning on those peer, patient survivors is so important, because as much as some of our families, want to be there and can be there, they don't firsthand understand what you're going through. They see it, they can try as hard as they might, but talking to a fellow patient really understands, and it's like shorthand language very quickly to get to the root of any issues you're having.
Yeah.
Gail, did you
Yeah,
have something you
so-
wanted to add?
Yeah, I was just going to say, following up with what Susan and Michael said, it is about, for me, it's about boundaries, because sometimes people take liberties and they will say all kinds of things. I've had people, ask about HPV kind of in a derogatory way and things like that. And so I've gotten to the point that I don't want to engage in something that's not in my best interest, or conversations that are not in my best interest and not supportive. So it is all about boundaries and holding people accountable for their, when I feel like they've been inappropriate. So I think as part of the journey, as you go through this, you have to be mindful of what you need, because, and I think Michael said at the beginning, it's, it sounds kind of harsh, but it is an ongoing piece that we will navigate through continuously. So as you navigate through it continuously, you want to have the least amount of anxiety put upon you from anybody else, as you embrace those who are supportive and let go of those who aren't.
One question from before, and it was to Christy, but really for all of you that have been involved in this, any pushback at all from people about the vaccinations, and what is your kind of communication suggestion surrounding that if you get it?
I mean, I can jump in real quick and turn it over to my fellow panelists, but of course there's pushback. Vaccinations stir up all sorts of emotion. I am always open to other point of views and to hear other sides. And it's a very individual, decision. I understand that. I'm not there to cause trouble or stir up any debate. It's, if you don't want to do it, that's fine. But this is a HPV related cancer is something that can be eradicated.
Yeah.
Great. One question here that is specific. Who at work, kind of in the work setting, who and how did you share, and what did it feel right? Was it HR first, your boss, your direct reports, colleagues, kind of any suggestions for how to navigate that challenge at work?
You want me to jump in since I'm sitting in the office? I feel like a broken record a bit. We're saying it's sort of like it comes down to each person individually. I'm sure we all have, everyone on this panel and people who have called in or logged in, all have different work situations. For me, I went to HR directly. I also think, you can do a quick Google search and understand that there are sort of definitive rights that you and everybody have as patients. You are entitled to leave. You are entitled to having, if you're a full-time employee, you're entitled to having your job protected under short-term disability. And so those are, rights across the board. They shouldn't be questioned at all. I personally went to HR first because I wanted to make sure that they understood I would be submitting for short-term disability personally. I then told my direct boss and my direct reports, people who report to me. I personally made the decision not to tell anybody else at work. I kind of sort of just let it, I imagined it would sort of start to grow, but I felt like those were the people that I personally needed to tell. Again, everybody might feel different depending on how big your company. I work in a company of thousands. So, I felt like it was just important to go to HR, my boss, and my direct reports and tell them, and feeling confident that I'd gone to HR and understood my rights and how I needed to notify them.
I went a little differently. I told my boss first, just because that's a relationship that we have. And, you know, I knew from multiple experience with this that he would prioritize my health over everything. So I could let him know, and that way he would know why I was out at multiple appointments and tests and things like that, figuring out what would happen. And then I could work with him on a plan for the teams that I manage, which includes HR. So going to HR was something I would do, but it was also kind of my team. With the rest of my team outside of our HR benefits person, in some ways, I treated this like my child. Before I told them, I wanted to know what would happen to them so that I could go to them with that information. While I'm out, here's who you'll be reporting to, here's what you'll need to do. And I could kind of preempt lots of questions about what's going to happen to me when Laura is not here. That's just worked for me multiple times now.
That's great. Gail, I'm going to definitely get your answer for this, but then I'm also going to ask you another question that came in specifically for you, and kind of any tips on exiting difficult conversations. And please give us your thoughts about the workplace too.
Exiting. Well, I'm kind of bottom line, so I never try to be disrespectful to anyone, but I think I like what you said, Doctor, about, you know, kind of reflecting back on the person. And I kind of do that with conversations that are difficult. You know, why do you want to know that? Or what's valid for you in that question? I mean, I think that's the best way I can diplomatically bow out of a question. You know, I try to use some diplomacy and kind of reflect back to the person. So, and as far as work goes for me, I worked as a consultant in the mental health facility or outpatient program for kids. And the staff and the clinical team, they were very supportive. And in some ways, I think they felt really bad for me because before the cancer diagnosis in 2017, I had 4 surgeries that were related to spinal stenosis and all this other stuff. So I think they just looked at me like, oh my God, what is going on? So, but the harder part were the kids that I worked with, because now once again, I was going to have to find someone to do their therapy while I went through treatment and all those things. And that was the hardest part. And trying to ease them into my process while they were able to stay healthy themselves.
Yeah, Chris.
So I've been with this small firm for 26 years. So letting him know was not a big deal. My job wasn't a problem, but my wife got let go when I had my tongue biopsy done. They told her that it was pretty apparent that she wasn't going to be able to focus on work, and they let her go. It all turned out fine. She ended up at a place that not only hired her, but supported and I while I went through treatment. But it's not just for Christy, it's not just us, it's the caregivers can see the brunt of that as well.
Well, Chris, I'm sorry you and your wife had to go through that. I can say that from my side. I went to my boss and I went to my HR team and I said, listen, when I come to work, I bring my whole self. You get all of me. And there are going to be meetings where I'm not going to be focused. I'm going to need some time off. I'm going to perhaps need half days. I'm not going to be able to travel. And I was very upfront. I set the expectations, and, you know, thank goodness they accepted the expectation. Mm-hmm. They accepted it because it could have gone the other way with, you know, what your wife went through, Chris. And it makes me hurts that she went through that.
Oh, it was an addition by subtraction. It ended up
sure.
Okay.
Good.
Well, it's obvious though that everybody has kind of unique paths. And I think this kind of harkens back to how important it is to find other people that you feel like you can talk about this with, because, right, you guys are such gems for all of the community here, but close to wherever you guys are getting your treatment, there's going to be some of these kind of gems and other people that have done it. And so you don't have to do it alone, I think, is the biggest thing I'm hearing from you guys, is that, you know, it's important to figure out what your community needs to look like and then lean on them in the ways and communicate with them the ways that you need to do. One of the questions that came in, which is like a universal that I get all the time, and I'm sure you guys are dealing with this still, is how do I deal with scans and like scanxiety, right? And then how does that impact my communication, or the fact that I'm not like snapping at my significant other or freaking out at my colleague? Any words of wisdom there in our last few minutes? Oh, Gail, you're muted.
I don't want to be the major talker and just talking all the time, but I have to say, someone asked earlier about depression. I don't know about depression for me as much as anxiety. And I go every 6 months now, and I actually go next month. And that ride for me is 2.5 hours from Delaware to Pennsylvania up to UPenn. And I try to use some kind of calming, chants as I'm driving up. But the reality is, in my spirit, I'm nervous because I haven't hit that 5-year place yet. And it's like, okay, so what I would say for anybody, you have to try to ease your mind as best you can. But for me, the reality is the anxiety is real. And my spouse knows it too. As we drive together, she can feel it, because I don't want to talk. I don't want to do anything. I just want to get there, get in the machine, and get out of there. So.
Yeah, I would add I think about finding ways that ease the anxiety, even if just a little. I don't think it, at least for me, really truly goes away. I envy people who don't feel anxiety leading up to those scans. I always say when I have a scan, and if it's good news, man, those next 3 weeks, I'm so happy. I think it's just about finding ways that try to minimize that anxiety. For me, it's like taking a walk outside in nature. I've tried everything: sound baths, yoga, meditation, Reiki. I think be open to trying things maybe you haven't done before, since this is a new anxiety for most people. Maybe some of the things you've done before might not work. So be open to trying new ways of quelling that anxiety. And sort of keep trying and looking for something that might just help you relax a little bit as you're going up to them. But I would say it's normal, and you shouldn't feel bad about feeling anxious, because we all have that feeling.
One thing I would add too is that for me, scans are one thing that I don't tell people about beforehand, because I don't want to hold anybody else's anxiety. I'll need a text from my mom saying, how did the scan go, before I've gone into the scan. Happy to talk about it afterwards, but if there's ever a time for boundaries, it's before scans, as far as I'm concerned.
Great tip. You don't need to hold anybody else's anxiety on top of your own. And so choose what feels right to you. Yeah. Guys, I think we've made it to the end. Thank you so much for everybody. Your wisdom, your insights, your kind of honest reflections it's lovely to learn and hear from all of you. And I think those on the call, thank you guys for taking the time to join us. And thank you for the Head and Neck community for bringing this together.
Thank you.
Thank you.
Thank
Have
you.
a wonderful day.
Thank you. Bye now. All right, we're good. Bye, everyone.